Post-massive weight loss, facial fillers or facelift or both. Hello, I'm 45, female, and have been thin for 6 years. Previous to that, I have lost 490 pounds using diet and exercise only to get to my goal, and have had all the required reconstruction of skin except my face. My face is the only thing untouched. I'm not happy with the way it looks. I feel the filler is there but in the wrong place. I have added a pick, pulling back and relaxed. If I were your patient, what would you do and why? P.S. Fillers, I would prefer the reversible type.
Thank you for your question. You're 45 years old and you have a remarkable history in that you have lost in excess of over 490 pounds and that you remained thin for several years. You've submitted several photos and you're asking a question about improving your facial appearance and whether to do volume or whether to do cosmetic surgery. Now, your situation is becoming more and more common as people have significant weight loss in this country. And whether it's from bariatric surgery, whether it's from gastric banding and various other procedures, there's actually a separate specialty of doctors who perform surgery on the body to restore people's appearance after all that excess skin remains after all of that weight loss. Now, on the face, there can be various levels of excess skin. So, although it is normal to have a certain amount of facial volume loss and sagging and descent associated with facial aging, in a case of someone who has a history of significant obesity, we have to also think about the physical impact on the whole body in terms of the relative aging effect that it has on the body. There's no secret that obesity does have aging effects on the body. This is a basis for so many medical issues in this country, whether it's cardiac disease, diabetes, and as well as several different osteoarthritis and orthopedic issues. So essentially, being overweight does accelerate aging. And so in many ways, your physical age may reflect that, and the appearance may to a degree reflect that. But it gets down to the same basic principles of dealing with the aging process. And the thing is that you have to decide is what's dominating. Is it volume loss, which is bone, muscle, fat, soft tissue, or is it descent, sagging of the skin and the supporting structure of the skin? If the face was very inflated, then ligaments and all the supporting structures got stretched. And as you lost weight, depending on the method of how you lost weight, you can also lose a lot of the integrity of those structural aspects. What limits us in terms of advice is a physical exam. When a patient like you comes to my office, the first thing I do is do a little bit of a limited lift to see if the skin has room to move. And we then discuss that option and look at that result. It is my preference that someone who has facial aging changes, who has significant descent and sagging, that the volume is corrected after restoration of the proper anatomy, whether it's a facelift, face and neck lift. Sometimes it's a combination of a facelift with a cheek implant. But the point is that the struggle that you have, or part of your question was you have filler, but you don't like the way it was placed or where it was placed. Well, if you think about it, you have, let's say, this much skin, a lot more skin, and you have this much filler, it's going to get lost. And filler placement is really about strategy, and it's not about absolute volume. There's an upper limit to how much volume the skin and soft tissue can take before it starts to look amorphous And all over the city in Long Island where we practice, we see a lot of people with that pillowy look and commonly referred to as pillow face. And the thing is that we don't want that. We want you to look natural. So I think that you should start meeting with cosmetic surgeons and discuss these options. I think a surgeon would have more of an unbiased opinion in that they can offer both the surgery and the non-surgical options. You may also, if you don't have that much of a sagging and descent, then volumetric filling, such as the use of a filler like Sculptra, can be very good. A lot of people who have had weight loss will use a filler like Sculptra because this material, when it's injected, actually stimulates collagen, and it actually is very effective as a diffuse filling in the face. Sculptra was originally developed to help people with something called HIV lipodystrophy, or people who are HIV positive who are on medications that resulted in facial fat and volume loss that looked very, very hollow and sucked in. And so by using Sculptra, this material actually expanded and helped give this diffuse volume. So that might be worth considering. The material can last up to a year or longer. But again, it's a matter of answering the first question. Is there enough descent? And if so, is it worthwhile treating with facelift, face and neck lift, etc.? So there are a lot of different options between lifting and filling, so that it really requires more customized approach based on physical examination. So I hope that was helpful. I wish you the best of luck, and thank you for your question.